Ladies and gents, welcome back. There's been a lot of talk about our medical system here in Canada. There's whether it's the MAID system that's being introduced and offered to people inappropriately, to Bill 36 in British Columbia that's actually creating a more government controls over our healthcare system that's already hurting really bad. And a lot of people are wondering, what is it that we can do to fix the system? And someone who has been in the fight for some time now, the director of the Cambie Clinic, or the Cambie Surgical Center, I brought in Brian Day to talk with us today. Brian, welcome. Thank you so much for joining.
No, you're welcome.
So today I wanted to first and foremost introduce you to the audience here. What is the Cambie Surgical Center, and what is the main purpose that you're trying to put forward here?
So our surgery center was started in the mid-90s in response to the fact that a bunch of surgeons, mostly surgeons, but anesthesiologists, were having their operating room time in the public hospitals cut back. And many doctors and surgeons and anesthesiologists were leaving the country because they couldn't cope. And so, for instance, myself personally, over a period of several years, my operating room time at the public hospital was cut down from 22 hours a week to 5 hours a week. And I had 450 patients waiting for surgery. So that's a very frustrating thing. And we basically, knowing from around the world that these freestanding surgery centers are very efficient, we decided if the government wouldn't let our patients into their hospitals, we'd build our own. And we went ahead and did it right smack in the 10-year rule of an NDP government in British Columbia, with the tacit approval.
So what's the 10-year rule? Could you explain that?
Well, the 10-year, I meant that the 10-year, there was an NDP government in power for 10 years, and we opened our center right in the middle of their
Oh, I see. I
their
see. Now you're saying you were only allowed to work so many hours,
yes,
and
and
then what?
that's the same. That's the case today as well.
What's the purpose of the limiting of hours?
Well, it comes down to a very simple concept of rationing. So what government has done, because Canada, and a lot of your viewers won't know this, but we are the only country in the world where the government operates a monopoly in hospital and physician services. No other country does it, and so a hospital in Canada, again unique amongst the OECD developed countries, is funded on an annual budget. So, say a big hospital in Alberta or BC might get between $1 and $2 billion a year to operate.
Mm-hmm.
Every patient that goes there, whether it's the emergency or for surgery, is using up the hospital's annual budget. In contrast, in all of the other developed countries, like countries with public systems like England and New Zealand and so on, when you go to a hospital, the government pays revenue to the hospital for each patient that goes there. So it's the exact. So what this creates is a system in Canada where if you're the chief financial officer of a hospital, the last thing you want is patients because they use up your money.
So
It's a
there's
crazy,
yeah,
crazy system.
I wasn't aware of that. I understood that the government was the ones to actually pay out the hospitals in what it is
Mhm.
that they're required to operate. But if they're paid annually and it's not tied to any patients or tied to any work, there's no real incentive to even do any of the
No,
work.
there's a disincentive. There's a disin. I mean, it's like if you owned a grocery store and you were given all these groceries and but from an annual budget, and every customer that came in just took them for free, which is what we're talking about,
Right.
you wouldn't want customers. And that's why hospitals are geared not to treat patients if they want to be financially successful. It's the exact opposite in other developed countries.
So you've opened up the Cambie Surgical Center, and at this
Right.
place you've gone against the will of the government, and you're charging openly in a marketplace for operations or for.
Well, we opened, I say, with the the tacit approval of
Okay.
the government. They knew what we were doing. We checked with them, and part of the reason was our target patients initially were injured workers who were mostly unionized workers, and they are exempt. For some strange reason that has no logic, injured workers, um, and then federal employees and others who the federal government is responsible for, such as prisoners, are all exempt from the laws that prohibit a resident of a province from accessing surgery privately. So you cannot in Canada buy private health insurance for medical or hospital services. Again, that's we're the only country in the world where that is so.
Right.
And if you're a resident of Alberta or a resident of BC, you cannot legally go to a private facility in that province, but you can go to a private facility in another province. So, for instance, last week I operated on patients from Alberta, Saskatchewan, and Ontario, all quite legally, because they have rights within a province that, as non-residents, that the residents don't have.
This is a messy set of rules. Like it doesn't seem to have any logic to it. Was there a reason when it was enacted?
Well, it's no, this has always been the case. It's to preserve the public monopoly. So we have a massive government monopoly operating here,
Mhm.
with which has a lot of bureaucrats and administrators who are all government employed. A lot of them are paid hundreds of thousands of dollars in salaries. So, to give you a statistic, we have 11 times as many public bureaucrats in our in our hospital system in Canada, 11 times on a per population basis that Germany does. So we have 11 times as many government funded, government employed bureaucrats in the health system as Germany does.
Mhm.
Germany has a universal system, and we have massive wait lists, and they don't.
And
The
is it because they have a private option as well in Germany, or?
Well, the private option introduces competition. So
Right.
one of the embarrassing things about Cambie Surgery Center is you go there as you go there and you are exempt. You are basically being treated as as what we call the exempted groups, like the workers injured on the job,
Mhm.
and so on. You go there and you get treated quickly within a week or two if you need surgery. That makes the public system look bad.
Yeah, it sure
That's what they don't
does.
like.
Because
Yeah,
we have record wait times right now in Canada.
yeah.
It's
So
ridiculous.
so the governments don't like us because we make them look bad. But that applies to every monopoly. Like, there is no monopoly that is good for the person who wants the service, for the quotes customer. That monopolies don't, and especially when it's funded the way we fund our hospitals, then it's it is actually, it sounds crazy because it is crazy.
Because it is crazy. So
Yeah,
privatization is the buzzword that the politicians like to use, and it's a loaded word. I think that it's a loaded
yeah,
word, and it comes with a presupposition that healthcare or any industry that they're saying ought to be owned and operated by the government in any part of the economy that they say the word privatization in. Now,
yeah,
market economy in any industry, and we've seen this in healthcare as well. in LASIK eye surgery, for example, where it's completely private. There's no public option for LASIK eye surgery for vision correction, but yet the prices keep coming down, the service keeps getting better, and the technology keeps improving. Is this the kind of thing we could look forward to if we were to bring in a competition mechanism into our medical system?
Yeah, so there's a group called the Commonwealth Fund who rank developed countries' health systems. So they rank Canada's, um, they alongside 10 other countries that have universal healthcare. For instance, countries like Germany and Norway and Belgium and Holland and New Zealand. Canada ranks 10th out of 10th in access to healthcare. We rank 10th out of 10th in equity and fairness. We rank in Canada, the lowest income groups get the worst access, the opposite of what it's supposed to do. But add on that, of those 10 countries with universal healthcare, we are the most we are the most expensive. So there's something going drastically wrong with the health system. It's by every definition, if it weren't for the fact that you can just keep pouring tax funds into it, it would be bankrupt. Like there's no, but of course, governments have an an unconstrained ability to just keep using more tax funds. But even then, it's not enough. So, and also, I think this is important. Canada is the only country of those developed countries where things like medications, prescription drugs, and um, dentistry and physiotherapy are not covered by the public system. You have to have
Mm-hmm.
extended private insurance to pay for those. Those other countries cover those, and we don't. So this is a system in drastic need of control. You alluded, I think, before we came on the air to medical assistance in dying.
Mm-hmm.
One area in which Canada is ranked number one in the world is our medical assistance in dying.
The euthanasia system that
Yeah,
they have set
yeah.
up.
We do that more than anyone else in the world, and I don't think, and there is a connection. When you are suffering in pain for years and can't get treatment, people are being offered that way out of their misery and pain. The
I
other
read
thing is,
articles from even going back to 2017 where they were uh, saying that the upcoming euthanasia laws would actually save the medical system a lot of money. So they're actually boasting years ago about how offering medical assistance in dying would actually help save money.
well, a study just came out that last year 13,500 Canadians died on public wait lists. They died on public wait lists. Guess what? That saves governments a lot of money. They didn't have to do their surgeries or their treatments. They died, and that doesn't count the patients who died before they got on the wait list, waiting to be diagnosed. So this is a catastrophic situation. Um, Catastrophic situation we're in, really, and something has to change, and we have to look. As I say, we're 10th out of 10, and one of the analogies I use is, if you were the 10th ranked hockey team in a league and you were spending more than everybody else above you and you had worse results, wouldn't you look at what the top two or three teams are doing and try and learn from their methods? That's what we should be doing in healthcare, and we're not doing it.
Well, I think the Toronto Maple Leafs still have fans, but sorry, I just um, uh, so devil's advocate. There are so many people that will say if you introduce privatized medicine and then it works out, it's gonna crowd out the public hospitals until we don't have a public system, and then we're gonna be just like America. They say, as if America is the bastion for private medicine, and their third party payer system through insurance schemes is the way to go if you don't do socialist medicine. What would you say to that?
Well, as I say, the comparison has to be with similar countries that have universal healthcare, and we are the bottom of the pack in those.
Mm-hmm.
So every other country in the world, no other country in the world operates a government monopoly in hospital and doctor services. Only Canada, no other country. So this is legal in every other country on the planet. How can it possibly be that we're the only ones that are right, and yet our wait lists are the worst, and we're spending the most? So it's a, and I don't believe in privatizing the system. I just think you need a little bit of competition. We have that, all of the arguments that are used against healthcare could be used to say all grocery shops in Canada should, and food supplies should be run by the government. It could be run to say we need to close down all of the non-government schools in Canada, the independent schools, the religious schools, the private schools, because those people are going and quotes getting a better education. Well, no, what they actually do is they enforce the government system in education to perform at a higher level, because there's something there to compare it to. When one of the biggest things about one of the biggest sources of embarrassment, as I said, of our Cambie Surgery Center is we make the government system look bad, and that's because it is bad. It's I say people dying. We're talking about people waiting longer than the government's own studies say it's safe to wait. So these are patients are suffering and dying. And we talked about, MAID just now. The other thing that's devastating the country is narcotic addiction and overdoses and people who are waiting in pain for a year or two, they take narcotics, they become addicted. We are creating addictions when we keep people waiting in pain and having to give them painkillers to control the pain, and eventually they need more and more, and so on. And there are examples in every province. A young 18-year-old was reported in Victoria, in the newspapers fairly recently, who was waiting a long time for a shoulder operation, got the operation, was given painkillers, eventually through dependency on the narcotics became addicted and ended up dying of an overdose at the age of 18. We are creating these problems. But as I said, we could use the arguments that are used against allowing. I don't believe privatizing the system. I mean, allowing some private competition.
Right.
Um,
You're
that's
not you're
all.
not advocating getting rid of the universal medical system, just
No,
having
but I
another
can tell
layer
you,
to it.
yeah, but I can tell you, this is, might be interesting. There are countries like Switzerland. I lived in Switzerland for 6 months, and worked there as during my um, training to be an orthopedic surgeon. And in Switzerland, it's pretty well all private insurance. But guess what? And private hospitals, the government pays the premiums for those that can't afford them. I mean,
Right.
that's a pretty that's a way out. And this argument that, oh, if the rich have access to private healthcare, well, the rich don't suffer in any province or any country, because they get on a plane and go to the United States.
Yeah, they go somewhere
Over
else.
they go somewhere else. So this isn't about the rich. This is about the ordinary people. And as I said, the data show that the worst health outcomes in Canada, the worst access, is in lower socioeconomic groups,
So tell me
and
about
that's a
your
fact.
tell me about your legal struggle. So you've been taken to court by
Yeah,
the government, and you lost your case in a lower court, and
yeah.
now it's going to the Supreme Court. What is it that they're coming after you for?
Well, we actually initiated it because we believed. So in 2005, the Supreme Court of Canada ruled that Quebecers who are on a wait list should have the right, if they're waiting longer than is safe, to use their own resources to access healthcare in Canada. That's so we're basically went to court, and we started in 2009, and our argument is simply, if you are suffering and possibly risking death on a wait list in Quebec, the Supreme Court of Canada said that you have a right to do something about it.
Mm-hmm.
We're asking, should Canadians who live outside of Quebec have the same rights that the Supreme Court of Canada gave to people who live in Quebec?
Well, that's
And that's what we're
only fair to ask.
Yeah, well, we're asking that, and so far, one of the problems we had with our judge is we knew from day one we had no chance with the original judge,
Mm-hmm.
because we could sense his ideology, but a lot of what he ruled was overturned in the appeal court at BC, but the appeal courts in Quebec also sided with the government. And as I said, we have to know that those judges are employees of the government that we're taking to court, and that to me can be an issue if they're not being totally objective. But the appeal court ruled that Canadians, this is an outright statement from the appeal court of British Columbia, Canadians are suffering on waitlists. Canadians are dying. BC residents are dying on waitlists, and it's a purposeful government strategy to ration access to healthcare. But they said there are theoretical concerns that introducing some competition might make it worse. Therefore, we're not going to go against the government. Now, let me just add to that the judge who made the original decision in BC has had surgery at a private clinic.
Because he's exempt.
Because, well, he's exempt, and he was under a contract. But the judges are exempt. They're federal employees. Members of parliament are federal employees. They're exempt. Senators are exempt. Federal, federal prisoners are exempt. So one of the things I kind of jokingly say, but it's not funny but it is a joke, is that our case is about getting rights for Canadians, who getting the same rights for Canadians who aren't in jail as our government has given to the Canadians who are in jail. We want the same rights as prisoners.
That's unbelievable. I had no idea that was actually in the rules. Is that just in British
That's the
Columbia, or
law.
is that across
No,
Canada?
that's in Canada. Yeah, that's in Canada. Any federal prisoner is exempt and can do what you cannot do in Alberta. So, so there's a lot of things to that just aren't logical. There's no logic in this. But again, I'd like to say that the point of having a little bit of competition is that it will make the public system better, and that's what the experience shows. And getting back to the hockey analogy or the soccer analogy, look at what the teams at the top are doing,
Mm-hmm.
and borrow from their ideas, especially when they're spending less than you are. That's where we're at. And right now we've now applied for leave to appeal this decision to the Supreme Court of Canada, and they will make the final decision. And as you know, healthcare is in the news every day now.
It is,
The
yes.
system it's collapsing, and basically governments are shuffling chairs on the Titanic as it sinks. It makes no sense what they're doing. What they should be doing is saying, "Oh, I see. Look how Germany and France and Belgium and Sweden and Norway, these aren't right-wing countries. Look what they're doing. They all allow a little bit of competition, and it makes their public system better." That's all we're saying.
And then also a revamp of how the hospitals are paid. Give an incentive, of course.
Yeah. And finally, another thing that they introduced in many countries, and Quebec has just started to do this, but and that is what we call a care guarantee. So we have now, and this is all in evidence our trial, that for every condition, every medical condition, there is a maximum time that the government has now accepted you should wait. But vast majority of patients are not getting treated in that timeline. So the other thing that countries have introduced is that if you go beyond the maximum acceptable time, beyond which the data, the science shows you're going to get, you're at risk of getting worse or at risk of dying,
Mhm.
you, the government will guarantee and pay for you to go and get that treatment elsewhere, either in a private clinic or in another province or even in the United States. It's a guarantee. And there's no reason why governments shouldn't be introducing that, because it's happened already in countries like New Zealand and England. That in England, after 18, you have a guarantee from the time your family doctor refers you for a procedure, that the maximum time it can be from the referral date to when you have the surgery completed is 18 weeks.
If only we could see dates like that. Right now, we're seeing wait lists in the 20s of weeks for patients, and it's getting too far gone. When you're screening for cancer, you can't. Time is money, and time
Yeah.
is life. It could be life threatening for a lot of people. So when do we hear from the Supreme Court? When do you get to see your day in court for that?
Well, we think that we're looking to get, first step is to get approval. You have to get leave to appeal, and we've applied for that. And then we hope the case, because we think this is urgent. I mean,
Mhm.
people are dying as they wait. People are becoming irreversibly harmed. If you're waiting with a degenerating condition too long, and it can get, and it can become incurable. And so we want this to happen urgently, and we hope by next summer or the fall that this case would be heard at the Supreme Court of Canada in Ottawa.
For some people, that's just too late. That's the sad reality of how this all works. Dr. Brian Day, I want to thank you so much for joining me today and explaining this to the audience. So many people are unaware of what it is that we're going through in our country, and other viewers of the channel from around the world don't realize how actually bad we have it here. Thank you so much for
No,
joining.
no, you're welcome.
And thank you guys all for joining for this conversation. I again, so much I didn't even know walking into this conversation about how bad it actually is, and hopefully this is the kind of conversations we need to have and share with everyone around the country on how we can actually improve the system and how we can get out of it. It's not a dichotomy of we're completely private or we're completely social safety net system here. We can have a mix of both, and we can care for patients that are very much in need. So thank you all for joining in, and we'll see you in the next one. Keep on trucking.